innovations in diabetes monitoring. So till now we were discussing about the different armamentorios, the different insulins or GLP-1 RS which are available in our country. So before going into that, I think I should add one or two more points which the slides are not there. I think when we were discussing about the monitoring innovations in managements, I think we have few more armamentarians. Recently, I think a couple of days back, or maybe in this year beginning, the FDA has approved first ever humanized anti-CD3 monoclonal antibody for type 1 diabetes treatment. Now, anti-CD3, humanized anti-CD3 monoclonal antibody, that is it is known as the teplizumab. It is available with the trade names of Zield, and it is the first available monoclonal antibody, anti-CD3 monoclonal antibody being approved by FDA for the type 1 diabetes treatment. Now, how it is being treated? It has been shown through the studies that it delays the stage 3 of the type 1 diabetes patients who are already on stage 2. So this teplizumab will delay the stage 3, and eventually the patients may not land up with the osmotic symptoms, which is a common phenomena we found in case of the type 1 diabetes patients. So that is the first ever monoclonal antibody therapeutic options for type 1 diabetes. Then another options we had, that is the combined SGLT1 and SGLT2 inhibitors, that is sotagliflozin. We know that SGLT2 that reduces or inhibits glucose absorption from the kidney, whereas SGLT1 inhibits glucose absorption from the intestine. So this and by this it reduces the blood sugar, but there are certain disadvantages or certain side effects of these. Chances of diabetic ketoacidosis is quite high. Genital mycotic infections, urinary tract infections. There is chances of hypovolemia, dehydration, transient rise in the EGFR and the creatinine, transient rise in the creatinine, transient lowering in the EGFR. All these side effects are there, but it is there in the armamentarium. So next comes to which we had from 1960 to 20. We can see that the CGM in the human subjects, the size of the CGM is a huge side, and there's a backpack insulin pumps also. Slowly to a decade of exceptional innovations took place between 2010 to 20. Time we get this all these CGM sensors like Dexcom series, Dexcom G4, G5, the Freestyle, Libre from the bot, and the Medtronic insulin pumps, that is Minimed 670G. So between these 10 years, there is an exceptional developments taking place in innovations in diabetes. So modalities, what are the ways by which we can monitor? It may be continuous glucose monitoring. It can be through a wearable sensor, or it can be through the self-monitoring of the blood glucose. How can the insulins be delivered? The first and foremost, age-old procedure, injections, MDIs. And the another is the insulin pump. Now, what are the developments of the pump is taking place? The pump, the first generation pumps, that is the programmable basal. That means the basal insulin is programmed. It is already pre-programmed irrespective of the patient. And then the patient initiated the bolus. Bolus is insulin, the prandial insulins, along with the corrections and the insulin sensitivity factor. Next generation pump comes with the pump with the CGM integrated pump, continuous glucose monitor integrated pump, which has a quality of suspend before low. That means the basal insulin administrations become low and stop whenever there is a chance of hypoglycemia. And then the next generation pump, basal titration based on the CGM sensor. So that is a complete closed loop. The CGM sensor, CGM is checking the blood sugar. It is being incorporated into the pumps. There is a machine algorithm which decides how much insulin is to be given, but the basal insulin dose is titrated as per the CGM values being provided to the insulin pump. And then the pump along with the CGM, where the correction doses, the prandial insulin doses are being also decided by the pump. So this is almost an advanced hybrid closed loop. And then the dual hormone pumps are there that I'll tell you in a short while from now. So these are the different pumps that we have. Unfortunately, not all the pumps are available in India. Minimet 670, Medtronic Minimet 670, 530, 640, 780, the latest one. These are available in India, but there are certain other pumps from the different companies, like from the Tandem T-Slim X2, from the Insulate corporations, that is Omnipod patch pump. Then the smart insulin pens, which are compatible or connected through the insulin pumps, the CGM sensors or the BGM glucometers, and then the Dexcom sensors with the compatible pump, and the Freestyle Libre CGM sensors. Next comes the CGM technology. What are the armamentariums we have? We have Freestyle Libre sensors, that is the Libre 2, Libre 3, the Medtronic Guardian Connect, the Dexcom G4, G5, G6, and G7 has also been rolled out, and the Eversense CGM sensors from the Sensualix. The Eversense is principally available in the European countries. Unfortunately, in our country, the Dexcom group sensors is not available. So what we have is the Freestyle Libre only from Abbott. But Medtronic Guardian, yeah, this is there, but that cannot be used solely for the purpose of ambulatory glucose profile, but that is being incorporated with the Medtronic 670 or the 780G pumps. Next comes the continuous glucose monitor or continuous glucose monitoring. That will revolutionize for sure in the next, I think in the next century or next 50 years. There will be an paradigm shift in the management of diabetes, both type 1 and type 2, with this revolutionary technologies, that is continuous glucose monitoring. So what is continuous glucose monitor? A continuous glucose monitor is a wearable body sensor that automatically and repeatedly measures the glucose at regular intervals, ranging from every 5 to 15 minutes. A CGM usually consists, there is a sensor, there is a transmitter that is being attached with the sensor, and there is a nearby receiver. So patients or the healthcare professionals usually get the reports, and there is a one-page report being, after 14 days, one-page report is being generated. Days is over, and the doctor has to go through and analyze the different sugar patterns, and on the basis of which the further modifications, be it on the lifestyle, be it on the pharmacotherapeutics or the medications or the diets, can be adjusted. So CGM versus other modalities. CGM, I've told you. What are the other modalities? Other modalities like wearable sensor. There is a lot of buzz about the non-invasive glucose monitoring nowadays. Now, there are organizations who are claiming that they are getting non-invasive glucose monitoring done through the use of the saliva, the tears, the sweat, and the interstitial fluid. But it has been seen that among all these, the interstitial fluid glucose is closely resembles the plasma glucose or the capillary glucose. We check it. And there is self-monitoring of the blood glucose, SMBG, which is an age-long process. We're continuing. There is also innovations taking place. There is one blood glucose meter from the One Touch VarioFlex from the Johnson & LifeScan that also has a software that is called the One Touch Reveal. So through that software, while it is being installed in the smartphone as well as in the healthcare professionals desktop, the healthcare professionals can get all the blood sugar results from the patients through this software. And there is also an extrapolation of these blood sugar values in the form of CGM waves, and through which we can assess the blood sugar parameters. CGM technologies, what CGM technology is based on? Currently, CGM uses an enzymatic technology that reacts with the interstitial fluid glucose molecules, liberating an electron for each glucose molecule, and that being transferred to an electrode where an electric current is generated. This electric current, proportional to the glucose concentration, is then relayed from a transmitter attached to the center to a reader or a computer, which displays the data to the patient. Comparison of the different professional and personal CGM systems. I'm not going into the details because of the paucity of times. Next is the accuracy evaluation. We have the instruments, we have the gadgets, but how can we ascertain that whether this gadget is correct or accurate or not? So that is dependent upon a value called the MARD value, MARD, that is mean absolute relative difference. Now, how far it is resembling or close or similar to the SMBG, which we are doing. So the accuracy comparison. So it has been said that if the MARD values of these gadgets are less than 10%, it is supposed to be a better one than the MARD values, which happens to be a higher values. Like we can see that the older generation CGM sensors has a MARD value of something around 14, 13 like that. But the newer generation sensors, like the Dexcom G6, G7, even the Freestyle Libre 3, I think they have reduced their MARD values below 9. So the less the MARD value, more accurate is the CGM sensor. Main characteristics, I'm not going into the details, but what as a snapshot we can remember that amongst the different sensors, that is the Freestyle Libre, the Medtronic, and the Dexcom series, that whether initially the first generation sensors used to need a daily calibration. The patient has to calibrate through the glucometer and to incorporate that data into it, otherwise the accuracy gets lost. But nowadays, excepting Freestyle Libre, the remaining others needs the calibration. Only the Freestyle Libre doesn't need calibrations. Accurate readings, even with acetaminophen, we know that there are certain medications in which sometimes when the patients are on medications, through the CGM, the blood sugar values comes as high. So even with the acetaminophen, it has been seen that with Dexcom G6 and Freestyle Libre, the reading values comes as normal, means the actual one. And sound alarms for low or high blood glucose level, the alarms are there with the Dexcom series. Unfortunately, with the Freestyle Libre, it is not there. Automatic glucose data sharing, it is with accepting Freestyle Libre, with all the others, the data sharing facilities are there. iOS app is also available for almost all the sensors. And that is the predictive low glucose suspend. This facility is there with the Medtronic Guardian Connect, as because we know that this sensor is attached with the patients having insulin pump. The standardized CGM metrics we need to know. Unless and until we need to know this metrics, we won't be able to interpret the CGM data which we'll be getting from a patient after 14 days wearing. So these are the standard CGM metrics. This has been proposed, this has been followed all over the world, irrespective of the type of the sensor used. So that is the number of days the same device is owned. It should be, it ranges, varies between 7 to 14, but ideally should percentage of time the CGM device is active, preferably 70% minimum. The average glucose, the glucose management indicator, the glycemic variability, which is expressed in terms of the percentage coefficient of variation. The standard practices, it should be kept equal to or less than below 36%. But in certain group of patients like who are on insulin or sulfonylurea taking medications, for them the glycemic variability should be less than 33 even. Then time in range, the proportion of time in a day during which the patient's blood sugar is maintained between 70 to 180. It should be at least 70%, but it varies depending upon the patient profiles. Then time above range, whether it is below above 180 or less than 250, or it is more than 250, that means time above range level 1 and level 2. Time below range level 1, that is less than 70 milligrams per deciliter, and time below range level 2 less than 54 milligrams per deciliter. So we need to know all these CGM matrices. So glucose assessment by continuous glucose monitoring, that I've already told you. It helps to find out that whether the patient's TIR is maintaining 7% of patient has achieved, because we know that the time in range is associated with the risk of the microvascular complications and can use for assessment risk. Additionally, you have to do the time above range, the time below range. In fact, it ranges between 0 to 100. So if you want to achieve more in range, you have to either curtail the time below range or time above range. This standard that will be CGM glucose file before, that is because the green is showing the yellows and red representing the time above range and the time below range respectively. On the right hand side, we can see that glucose indicator classification, and the middle is showing the entire the 14 days blood sugar variations. The it got disconnected, I guess.
Yes, doctor.
It is visible.
Yes, doctor.
So comparison, I'm not going into the details between the glucometer, the different types of glucometer, what are the accuracy standard being followed with these ISO 15197:2013 and the FDA guidelines for the blood glucose meter accuracy standards. These are the different types of CGM. That is the real-time CGM, where there is no reader. The patients can check his real-time blood glucose from the apps in the smartphone. And there is intermittently scanned CGM that may be blinded, that may be unblinded. The patients cannot see. That exactly we do with the Freestyle Libre Pro. That is the professional CGM, and professional CGM that is also blinded. The patient wears this sensor for 14 days, and then at the end of the 14 days, we take out the report, we analyze it, and we explain this to the patient. Now, challenges with the insulin pumps and the CGM in the management of type 1 diabetes. We have all the gadgets, but unless and until we do incorporate between these two, we won't be able to get the benefit that which we are looking for. That is, while both insulin pumps and CGM devices have been shown to improve the glycemic control and reduce the risk of diabetic ketoacidosis and severe hypoglycemia, but they principally rely on significant user input. That means patient has to give the inputs of insulin to carbohydrate ratio, the insulin sensitivity factors, the correction factors and all, and frequent insulin dosing adjustments. And we also know that the blood sugar varies on different days and different parts of a day. So these fluctuate. We'll be keeping in mind all this. Then there was a proposal of closed loop system in type 1 diabetes management. What do we mean by this closed loop system? This is a hybrid closed loop system using an algorithm that processes the real-time sensor glucose informations to automatically adjust the insulin delivery by insulin pump to bring the glucose level to a pre-specified target. So while users are required to administer the prandial boluses, the majority of the management decisions being automated. Now, following a decades of development, now we have come to such a phase that where the prandial insulin dose is also being decided by the pump through the machine learning and algorithm, depending on the CGM glucose being sent by the CGM sensor. So this is the schematic configurations of the closed loop system. There is a CGM sensor, there is a pump, and the CGM sensor is sending the glucose values to the pump. There is an algorithm which decides, and then the insulin is being delivered. These are the early closed loop technologies. See the dimensions of the pumps that it used to be. Then the JDRF, the Joslin Diabetes Research Foundation, has categorized different types of pumps into 3 categories: the first generation, second generation, the third generation. First generation, the number 1, number 2, and number 3, these are the first generation. When there is very low glucose, the insulin will be shut off from the pump. Insulin supply will be stopped. That is the first generation. Then hypoglycemia minimizer. When there is a prediction of hypoglycemia, there will be either cessation or reduction of the basal insulin delivery. And hypoglycemia and hyperglycemia minimizer. Similarly, hypoglycemia, if there is hyperglycemia, the pump will sense that, and there will be increase in the basal insulin secretion or the prandial insulin delivery. Second generation pump, where automated basal hybrid closed loop, that is closed loop at all the times with mealtime manual assisted bolusing. The basal will be adjusted by the CGM, and the manual only patient has to enter. And the fully automated insulin closed loop second generation pump, that means everything will be done by the pump. Even the basal and the bolus calculations will be done by the pump, not by the patient himself or herself. And the third generation pump is the dual hormone advanced hybrid closed loop pump. That means there is 2 hormones, there is 2 infusion sets, one for the insulin, another for the glucagon. This is particularly important for the type 1 diabetes patients. So if there is hypoglycemia, then the glucagon will come into the picture, and that will normalize the sugar. When there is hyperglycemia, then the insulin will come into the picture. Insulin secretions in delivery will be more, and the blood sugar will be normalized. And both insulin and glucagon delivering this at an interval of 5 minutes. Commercially available and in development hybrid closed loop systems, Minimate 670G. Fortunately, in our country, the Minimate 780G, which is nothing but an advanced hybrid closed loop, that can be called as an artificial pancreas. In our organizations, it has been prescribed to many of our patients, especially the type 1 kids, and they are doing brilliantly well. And then Omnipod Horizon patch pump. Patch pump, the peculiarity is there is no infusion set cannula. There is no infusion set. There is a patch pumps attached with the skin in the abdomen through an adhesive. There's a small light, and there is no cannula. Adhesive needs to be changed at an interval of 3 days. And as because there is no cannula, the chances of infections are also less. Then there is tandem T-Slim X2 pump, which is called the ACE-enabled pump. What do you mean by the ACE-enabled pump? ACE-enabled pump means that is the alternate controller-enabled infusion pump. What do you mean by the ACE? ACE means in simple word is It has got two technologies, the tandem TSLP X2 from the Tandem Corporation. That is the basal IQ technology and the control IQ technology. Basal IQ technology, when there is a chance of hypoglycemia, the pump will sense it half an hour prior. It will stop or reduce the insulin flow. The blood sugar will rise. Whenever it comes to normal, then the basal secretion will start. And the control IQ technologies, when the blood sugar is high, running high, the pump will sense it half an hour prior, and then there will be prandial insulin delivery, more prandial insulin delivery momentarily, so the blood sugar will comes to normal. But the thing is, both the basal IQ and the control IQ cannot be activated same time on a single patient through this pump. Compositions of comparisons of the closed loop systems, I'm not going into the details of it. It's the patch pumps. That's what exactly said. This is in this patch pumps series, that the new edition is the secure simplicity. Now, what is this secure simplicity? This is just a prandial insulin pump. This is applicable for the type 1 diabetes patients or even the type 2 diabetes patients. I think they have come up with the type 1 diabetes patient first who doesn't want to take so many insulins. They might have to take the bolus, the basal insulin at night, but at least they can reduce the prandial insulin. 3 pricks they can reduce. And this pump will just deliver the prandial insulins as per the requirement. And this is 2 units written, means with one push, there will be 2 units of insulin delivered, and subsequently the patient is getting 10 units bolus before lunch. So the patient has to press that 5 times. So the patient will get 10 units insulin instantaneously. He or she doesn't have to take through the multiple dose injections by needle prick. So at least if the patient is on basal bolus therapy and on 4 times insulin, at least 3 times prandial insulin for the period of 3 days, the patient got rid of this needle prick for 3 days. So that is the secure simplicity. History of the filter pumps, I've already told you that the stage of integrated pump: suspend on low, suspend before low, then hybrid closed loop, basal being titrated as per the CGM sensor value, then the meals or the prandial insulins are also titrated, and then the multi or the bi-hormonal closely advanced hybrid closed loop insulin pump. These are the pumps, different pumps. Evolution or guideline of the years. Lifestyle, we know from our student life that how to approach a diabetic patient. So, for management is concerned, we will be depending on the lifestyle modifications to overcome the social determinants of health, support, rest, physical activities, flexibility, aerobic exercise, endurance training, and all. If it doesn't respond, then we'll start with the monotherapy, preferably with metformin first, and then after 3 months, if it is not HbA1c is not controlled, dual therapy. 3 months, HbA1c is not controlled, triple therapy, and then the combination injectable therapy. But now we have a era of a patient-centered, individualized, comorbidity-based selection of anti-diabetic agents.